So if you've ever wanted to know why it's so expensive to go to the dentist, or if your kids should stop drinking fizzy drinks or sugary drinks, or if you should use mouthwash after you brush, well, I'm here to help. Whakalowhalahi atu kia matolo osi. Kia ora koutou katoa, ko Chanae Ihimaera tōku ingoa. I'm Chanae Ihimaera. I'm a senior lecturer at AUT in Oral Health, and this is Teeth Matters. So why is it so expensive to go to the dentist? That's quite a common question that we get. It's all about context, right? Like we might spend $250 on a haircut once every 2 months, or a concert ticket. So it's really about what you think is important. The mouth is kind of the window to our overall health, and if we're not going to invest some time into that, we run the risk of other systemic diseases like heart disease. So it's really important. So we've just got to think about that upfront cost can seem very daunting, but in the long term, it's well worth it. But one thing to remember is that dentistry is a very expensive profession. For example, a chair, like a dental chair, can cost up to $50,000 right up to like $200,000. So those costs have to kind of be passed on. The other thing to remember is that, we were using tools that have to be sterilized and have to go from mouth to mouth. So that kind of technology is not cheap. So that's kind of one of the things that it comes up quite often. And the other thing too is you can ask your dentist, like just basically ask, like, what am I paying for here? So the next question we have is, should I use mouthwash after brushing? So it's not really a kind of mandatory everyday kind of hygiene practice. I would do that if it's recommended by your oral health professional. We don't want it to be an and or. It might just be a simple instruction like a warm salt rinse after your dental treatment, which is showing very positive results afterwards. So our next question is about the purple toothpaste or the charcoal toothpaste, which is quite a common thing that you might see in the supermarket. So the thing with the purple toothpaste and the claims that it makes your teeth white is that purple is on the opposite spectrum of yellow. So when they mix together, they do have the illusion of whiteness. So yes, your teeth will appear white for as long as that toothpaste is on your teeth, but it's quite short-lived. So it's better to just have really good hygiene practices, brushing, flossing, and just keep up with your usual routine. I've got a question here about stains. So do foods stain your teeth? Most definitely they can. They can contribute to staining of your teeth and especially around the edges where it's a little bit harder to clean. So food and drinks like tea, coffee, and also herbs like turmeric and some other like bright herbs can definitely contribute to that. The other thing is if you smoke, you're more likely to have some staining as well. But what you can do to help that is just have some water after you have those kind of bright foods or drinks, swish it around to try and get that stain not stuck as much. So do we need to brush twice a day? The answer is definitely yes, like it's highly recommended. But if you are so busy that you can't and you can only do once a day, then I recommend just the nighttime. So if we think about why that is, we have saliva in our mouth during the day, and saliva is our natural defense that keeps our teeth strong, bathes our teeth and keeps it strong. When we sleep, the saliva glands go to sleep as well. And so they can't do that protecting. So if you've got plaque, and which produces lots and lots of bacteria, that is just going to cause really bad morning breath in the morning. The other thing too is if you see some plaque, like even if you're not going to brush twice a day and you see a bit of plaque, if you were to like scrape a little bit off and even have a sniff, like it's disgusting. It smells like, starts with S, rhymes with hit. It's really gross. Should I floss or should I use a water flosser? The options are either would be recommended. The thing is that when we think about when we brush, the toothbrush bristles just can't reach between our teeth. They can't remove the plaque that's there. It's just not possible. And we have natural pockets in our teeth, in our gums, and that's where the plaques accumulates And if that's not removed, it puffs up, gets infected, which is kind of a small inflammation, and will just cause more problems. So if you can floss, that would be great. Sometimes your fingers might be a bit too big. They can't fit inside your mouth, so it's a little bit hard to do, and it's a little bit tricky. But water flosser is a really good option as well. Okay, so what if you're scared to go to the dentist? What if you feel anxious or have not had a good experience in the past about going to the dentist? I would recommend coming to see us. Dental therapists and oral health therapists are way cooler. We deal with children, that's our bread and butter, and we are very kind and very patient. But the same with adults too when we're doing your periodontal disease treatment, as well as your hygiene cleans. We recommend just talking to your dentist, say to them, I'm not feeling too good, I'm really nervous. So being open with your communication is always really helpful. You can do some nice breathing exercises. The other thing too is we as dental professionals aim to provide pain-free treatment. Like that is one of our aims. So we're not saying that it shouldn't be uncomfortable, but it should definitely be pain-free. So if you are having a procedure and you're not feeling discomfort, but you're feeling pain, just simply put your hand up and say something. So the other thing too is if you have had a good experience and you have managed to calm your nerves and you've managed to have a great dental experience, why not help someone else? Share your experience, even offer to take them to their appointment or offer to sit with them at their appointment. Because often we might have that sense of shame or judgment because we haven't been to the dentist for such a long time, or we can feel there's things that's happening in our mouth. And that's just a step towards being a great human. Is an expensive toothbrush better than a standard one? So the evidence shows that it is actually better. And the reason is because it does a better job than you. Like it can actually move faster. The head can go around a lot faster than you can with your manual brushing. But in saying that, they're becoming a bit more affordable. You can see them in the supermarkets now for around $30, even cheaper for the children's ones. But if you can't use that, then just a normal soft bristle toothbrush is fine. It's absolutely fine. So what happens if my gums bleed when I brush my teeth? So that can be quite a common occurrence. So what we want to do is we might think, oh no, it's bleeding, I'm going to stop. But that's what you should not do. You should keep brushing and keep doing your hygiene practices. I would also make sure that you're up to date with your dental appointments, with your oral hygiene appointments, because there could be something underlying in that bleeding. If you find that the bleeding stops after a few days, it means that you're on top of your brushing and the gums are no longer irritated by the plaque and the bacteria. So keep up the good work. So if I play sports, should I use a mouthguard? Yes, absolutely. Absolutely, you should use a mouthguard. A lot of sports, you have to wear a mouthguard. And what we would recommend if you have all adult teeth, which is usually from around 12 years old upwards, is getting a professional fitting of a mouthguard. But the Boyle ones are absolutely fine if you have baby teeth as well. Those that will be sufficient. Okay, do my kids really need expensive braces? So this is not my specialty area, but what we do is we refer to the specialist orthodontist. The thing is that some people need braces for function, so they can't actually, their teeth don't meet together in the right ways, and then they can't eat properly, they can't breathe properly as well. So we would highly recommend you get an assessment to find that out. The other thing too is you might get people saying that their teeth are a little bit crooked and they're recommended to go see an orthodontist. There's no kind of timeline, so don't feel pressured into getting that done as soon as you get to the referral. There's no pressure on that. Like you might ask the orthodontist, is it okay to leave this for another year? Can we look at this another time? Yeah. Right, sugary drinks. Will they make the kids' teeth rot? I know they love them a lot. Definitely they can contribute. So if your children are having sugary drinks every day, it's definitely going to show. So what we would recommend is that, it's limited. We're looking after our kids, so we want to try and decrease the frequency that they're having it without taking the fun away. We don't want to not have any treats at a birthday party. So maybe you go to a birthday party, they have their treats, and then on the way home they have their water, and you're doing the great hygiene practices with them at home. So win-win. The other thing too is that some drinks contain no sugar, but what we need to be careful of is that they may be fizzy, and so that means that they're carbonated, and that contributes to erosion of enamel. So once that erosion has kind of taken place, there's no getting it back. So you might notice in your mouth when you're brushing or you're flossing and you see your teeth look a little bit transparent, they're a little bit see-through. That's the effects of erosion. So carbonated water or sparkling water will do that as well, like it can erode your teeth as well. One way that we can mitigate that is we might drink faster. So try not to sip on it. Try not to sip your drinks over a longer period of time. Drink it a little bit faster, or better yet, use a straw, and then they don't touch your teeth at all. So I hope you found these questions and answers about Teeth Matters really helpful. If you have any further questions, please write in. We'd love to hear them. And thanks for watching.